Health in Nigeria, I know, was born out of a deeply personal experience. Can you take us back to 2016 and what you witnessed in the healthcare system that moved you to take action in Nigeria?
I grew up in Nigeria. I tell people, listen, I'm an American citizen, but I tell them I'm Nigerian. I
Yeah.
grew up in Lagos, and I speak the language very well. I'm still very well connected to the culture. When my dad was ill, I actually went to Nigeria and I was there with him. I was there for almost 2 years, and so while I was there spending time with my dad, it was very important because I had the opportunity to connect with him, but I had a bigger opportunity to see Nigeria as an adult, as an educated adult. I had the opportunity to not only assess or experience the academic landscape, but also the medical landscape in Nigeria and identify some of those gaps.
Mhm.
Uh, I came back to the US end of 2017, so I was there the whole of 2016 and 2017. And when I got back, if I tell you that I couldn't sleep, like I kept thinking about Nigeria, kept thinking about my experience. I kept wondering what I could do to contribute. I met someone in Nigeria whose experience, kind of sparked Help for Nigeria. She was the CEO of Teach for Nigeria, Olawe Omikunle, and she had mentioned to me that whenever she would visit the schools that they had teachers in through their nonprofit organization, they would always ask them when they would do something in the healthcare space. And she had encouraged that if I was interested in doing something in Nigeria, I should consider doing something in the healthcare space. So we started Health for Nigeria in 2019. And the goal originally was just to increase access to primary health care for everyone, especially those in rural communities. We came up with this vision. I worked with a gentleman at the time. He had an MPH from Hopkins and he moved back to Nigeria, and he had recommended that we should consider putting nurses in high schools. So those are public rural high schools. And if we could place nurses there to take care of not only the children, but the teachers and the local community, that could be a way of increasing access to healthcare. So we started our first clinic, if I remember correctly, in 2020. And today we have 12 clinics in 12 different high schools in 6 states in Nigeria. So that's something I'm very proud of and very excited about.